My name is Laura Johnson. I'm the manager of the Cardiac and Pulmonary Rehab Department at ECHN. Cardiac rehab is a combination of both exercise and education. It provides patients, family members, community with the resources it needs to fight heart disease, which remains the #1 killer in the United States today. Here at ECHN, we have a unique program, a home cardiac rehab program, where our nurses actually go out into the community in conjunction with the visiting nurse and visit patients that most of them have just had open heart surgery. So they go in with a monitor and they begin low-level exercise and education with these patients. I belong to Cardiac Rehab Society in Connecticut, so I network with a lot of nurses and exercise physiologists throughout the state, and I do believe we are the only hospital that provides that service. We're very proud of that. In addition to that, we offer phase 2 cardiac rehab. So let's say the patient who finishes with the home program will then go into the phase 2 program, which again we have at both Rockville and Manchester. It's an outpatient service covered by most insurances. The patient wears a monitor, they come in and they exercise. We have lots of equipment. We're kind of like a gym in that regard. We have treadmills and bicycles and arm ergometers and rowers and lots of things. And the patient exercises at their own level in conjunction, again, with what their doctor has ordered for them for cardiac rehab, and they're progressed gradually through the program. Again, wearing a monitor, it's very safe, it's very controlled, and then once the patient graduates from that program, we offer a phase 3 program because we tell them once you graduate, that doesn't mean your exercise is finished. You need to continue with your active lifestyle. And we do offer the phase 3. Many folks feel comfortable coming back into the hospital setting, working with the nurse, knowing that there's a nurse there to monitor them. So it's very safe, very structured, and it offers that nice continuum of care. So we try not to let anyone slip through the cracks. February is Heart Month. And the reason why we take a month to recognize the importance of taking care of our hearts is because it is the #1 killer in this country. A few years ago, the Heart Association expanded the concept of Heart Month to include Go Red Day and Wear Red Day. The purpose behind that is heart disease kills more women than any other, all of the cancers combined, breast cancer, lung cancer, and I don't think people realize that. So I feel now we're finally offering women an opportunity to realize they have to be good to their hearts. Many times they're caregivers and they're taking care of everybody else, and they kind of come last. So now we're trying to bring that out in the open so that they are aware of all the risks and how to take care of themselves, how to love their hearts. We wear these little red pins. It's more than just a fashion statement, the red dress. It actually helps, again, get the word out to the public that they have to watch their blood pressure, take care of their weight, make sure that they're exercising the way they should. If they're diabetic, maybe, control their blood sugars a little better. Take that salt shaker off the table. Different things that women can do to help themselves to live a longer, healthier life. February is a big month for our department. It's when we have the opportunity to help people understand the importance of taking care of their hearts. It's Heart Month. One of the activities that we do is we go into the cafeterias of both hospitals, both Rockville General and Manchester Memorial, at lunchtime on Wear Red Day, which is the first Friday of February, and we do risk factor screening. We take blood pressures, we talk to people about their cholesterols, we provide educational materials for them, and it's a great way to meet with employees, visitors of the hospital, and community members. Another thing that we're doing is we're sending a nurse to St. John's Episcopal Church in Vernon to speak to the Women's Club there on women and heart disease. We'll be doing that in February. Another thing that we're doing that we started about 3 years ago that I think has really been a very valuable program is we feel you're never too young to learn how to take care of your heart. So many children are obese. Their blood pressures are high. They're becoming diabetic. So we feel a need to get out into the schools and teach children how to eat, how to exercise, and hopefully take that message home to mom and dad. We've been targeting 5th graders, and we'll be sending a nurse over to the Maple Street School in Vernon and to Washington School in Manchester. And as I said, we've been doing that for about 3 years now, and it's been very well received. Students love it, the nurses love it, teachers are crazy about it. They look forward to us coming. And then we also have Dr. Jeffrey Thompson, who on the 23rd of this month is going to be giving a lecture on women in heart disease. Don't be blindsided. That's free to the public. We're going to be holding it at Wood Lake at Tolland. So that is, we look forward to that as an opportunity for people to get out and learn more about how to take care of their hearts.